Good morning, and thanks for joining this webinar on COVID-19 and the EU response, No Time to Rest. My name is Gary Finnegan. I'm a health journalist and the editor of Vaccines Today. We have a really excellent panel with us today, representing the European Commission and Facebook, as well as experts on economics and epidemiology. I'll introduce them to you in a few moments. First, let me just tell you how to take part. It's really important that we get some questions and some feedback from you. So if you want to ask questions, use your personal accounts on either Facebook, LinkedIn, YouTube, and add comments below the video that you're watching. We'll try to get to as many of the questions as possible in the next hour during the conversation, and then we'll dedicate a session at the end to Q&A. So keep the questions coming, and we'll store them all and try to answer as many as we can. So our topic today could hardly be more timely, focusing as it does on the impact of the pandemic on public health and on our societies and our economies. We'll be looking today at the ongoing challenges and how the EU has responded. We'll be reflecting on some of the lasting impacts that COVID-19 will have on health and the world of work, on education, and on how we consume and share information. To help set the scene, I wanted to look at some of the key findings of an online consultation that Think Young has conducted under the Young Coalition for Prevention and Vaccination initiative, who are our hosts today. I'll reflect a little bit on it later in the session, but it's a very extensive survey conducted over several months, and it revealed some really interesting things. So there's a lot of concern about the second wave that we're experiencing now, about the impact of the pandemic on inequality and job opportunities, as well as on health and other issues. It also shows, quite interestingly, I think, that respondents are still concerned about other crises, climate change, air quality, and other things like that. So, so we're dealing with more than one crisis at a time here. So, there's a lot of things on people's minds, it seems. So I'll try to come back to some of the more specific findings in a while as our conversation continues. But let me first bring in Isabel de la Mata, who's a principal advisor for health and crisis management at the European Commission, which I'm sure is a very busy role these days. Isabel, I think the last time the coalition held an event, we were in the Parliament, and it was in late January, I think, and a lot has happened in the meantime. So how has the Commission responded to the COVID-19 pandemic?
Yeah, you are right. We met at the end of January, and it seemed that was 10 years ago instead of just 9 months ago. So the Commission is trying to respond, cooperating with the member state and supporting the activities of the member state, but in a broad sense. I mean, it's a cross-cutting activity, not just focusing in health and public health, but we are also working on jobs and economy, travel, research and innovation, emergency support, digital solutions. So this pandemic has got not only on people's health and a lot of people are in the hospitals and they are dying, but at the same time they are having impact in the daily life and the daily conditions, and the economy is one of the main areas. So we have been developed all the different instruments that are available. I mean, from coordinating with the member states to deploy our agencies, the ECDC and the European Medicines Agency, to try to bring solutions, so treatment, vaccines, following the situation, working with the companies that are producing these vaccines, treatment, personal protective equipment, other medical devices, and also buying some of this equipment directly to distribute to the member state or via joint procurement with the member state. We have developed legislation, or we are developing legislation and proposal. This is the package of the 28th of October. And also about testing, we are developing the new one that will be approved on the 11th of November. And I mean, trying to do everything that has been possible, and that is possible to fight this pandemic that is something new for everybody, and that we don't have any precedent at in the last year. I remember what we were doing, what we are saying in February at the beginning of March. This will be like the SARS, this will be like the avian flu, this will be like the MERS, and no, this is not being like any of those. It's completely different, completely new. We are learning every day, and this is also one of the main challenges that we don't know. We don't have all the answers, and we need to develop every day, and every day is a new challenge for everybody.
And,
Thank you.
and tell us about the testing you mentioned. A new test will be approved later this month. Is that correct?
No, I mean, and there are many tests that are being developed, but where we are working more now is in the rapid antigen test. It's not only one test. I mean, many companies are working on that. But well, at the beginning we had the PCR, we have the ELISA test to detect the antibodies, and now the scientists are putting a lot of hope and faith in developing rapid tests, because the PCR is the golden standard, but it takes time to have the results. And to really better fight the pandemic, what we will need are tests that are able to give a result in 15 minutes, 1 hour, 2 hours, so quite quickly, and that could also allow people to move, but and to work, but especially to make a rapid detection when someone has symptoms and go to the hospital, for example, or in the school, or in the places. What we are developing now is a recommendation on the use of this antigen test with the ECDC, of course, and also with the member state. And what we are doing also is to buy these tests. Maybe the emergency support instrument that was reactivated in April, and that allows to do procurement of different things. We did for the mass, we did for the severe, and now we are going to do for the rapid test. And also joint procurement with the member states. So all that is what we are doing with the
Okay,
Thank
and on just a quick question about vaccine distribution. So I suppose at the beginning that we won't have enough vaccines immediately. That's normal, I suppose. So what role does the Commission have in ensuring that citizens across Europe have access to vaccination?
Yes, yeah, you know that we are working with several companies in advanced purchase agreements. We have signed 3 until now, and we are still discussing 4 contracts or agreements with different companies, and this is like that in order to try to ensure that we will have vaccines. I mean, maybe not all of them will succeed, but we have bet on different technologies. This is why we are discussing with different companies, different technologies, and hoping that some of them will work. One that we will have then approved by the EMA. The production will begin. The companies are already establishing in different member states manufacturing capacity, and the production and the distribution will begin. At the beginning, that we don't know when will be the beginning, but probably the beginning of 2021, we will have some doses. We will not have all the doses, the million doses that we have bought through this advanced purchase agreement. But the distribution is going to be done with the member state. So we will decide with them in pro rata to how we are going to distribute, but to all the member states, and without forgetting that we have a commitment with WHO and the international community through the COVAX. We are establishing we are discussing with the member states, and the member states have to establish their own vaccination plan, deciding which one are the priority population to be vaccinated based on the risk. I mean, one population, it is clear that is the health professionals, because they are the most exposed to this virus, and the one that we have to protect, because if we don't have health professionals, we could not continue to beat the pandemic. And then for the rest of the population, the member states are establishing the vaccination plans. I mean, for the elderly population, but also essential workers, like could be, I don't know, drivers or teachers or other essential workers, but we are still developing these vaccination plans. We still have time, because the vaccine will not be here before 2 months. We think, we will hope that next week we will have the vaccine, but I don't think that this is feasible. So yes, we continue, and for that we have the Health Security Committee, and we have also the IPCR that is discussing in the Council. So the different mechanisms of the European Union to achieve this goal. Thank you.
Great, thanks a lot, Isabel. It sounds like science is doing its thing, but in developing tests and therapies and vaccines. But let me bring Anya Helseth in, Public Policy Manager for EU Affairs at Facebook. Anya, Dr. Tedros, the WHO Director General, warned of a dangerous infodemic in parallel with the pandemic, the infodemic of misinformation. How serious is the spread of inaccurate health information on social networks, and what can be done about this?
Yeah, thank you very much for this question, and really interesting to hear Isabel intervention earlier. It's basically what Facebook is trying to do is exactly to give the front spot to the health community out there trying to do their job. Obviously, the issues around misinformation or what was phrased here as infodemic, we take this very seriously, and this is absolutely the responsibility we see on ourselves to address. So basically, our approach since that situation came into play, since basically March, is to apart from measures that we already had in place on tackling misinformation, is to address specifically issues around COVID misinformation. The focus so far was basically on connecting people to credible information on Facebook, but also across various apps, Messenger, for example, Instagram and WhatsApp. The approach to misinformation, specifically on COVID, working together with news industry and investing basically serious grants in that space, and working again with fact-checking organizations across the world. So since basically the health organizations declared COVID a national pandemic, cross-national pandemic in January, our focus was first to give people the accurate information. There is a COVID info center appearing on Facebook, appearing on other applications, which basically links to latest information by authoritative sources such as WHO or national health authorities. We estimate that so far around 2 billion people were directed to those sources and basically interacted with pop-ups on Facebook, Instagram, daily amounts within around 350 million. From our perspective, however, connecting the people to authoritative sources information is just one part of the picture. We are trying to actively stop misinformation and harmful content around COVID, and the approach is twofold. First of all, we work with the fact-checking community that across the world we have around, as of today, 60 fact-checking partners around the world working in 50 languages, and they basically cross-check all the posts that appear about COVID and label if the information is deemed inaccurate or is not confirmed by any kind of authoritative source of information when it comes to health. We also decided to take an additional step, so to say, to address the issue of imminent physical harm, especially when the pandemic was in its, let's say, early stages around information that was available, how to potentially treat it. There were some information going around internet, but also of course on Facebook, that for example you should drink bleach, it will help you, or you should take certain things, and that will prevent you from getting COVID, which was absolutely inaccurate, but also was very dangerous if people would follow this advice. So this kind of advice we were in fact taking down, which is a little bit different approach to generally what we do with misinformation, where we prefer people to be informed, see the label, and we from research so far see that that limits the virality and the spread of such misinformation. However, as I said, with advice, so to say, that would lead people to having health danger and risk, we would take the approach of taking it down. As I said, the other part of the picture is the support and the work we do with fact-checking community. We often talked about the problem that Facebook is a private company, unable to, of course, distinguish what is misinformation, what's not. We're not experts, and especially here, the level of expertise is absolutely required, that people are connected to the right information. So our fact checkers are relying on organizations that are recognized across the world as experts in that space, and of course the support that we offer to news industry, which has essential role in bringing and surfacing the right information, the correct checked information to among everyone, our users as well. So perhaps I will stop here. This is just the outline of most tools we took so far. There is a lot more, but looking forward if there are any questions.
So some of those messages, I've seen them. If you search for information on Facebook or the other platforms, you'll get this message for WHO or a national authority. What about closed groups for things like vaccination? There are big closed groups where they share information amongst themselves. Has Facebook been closing some of those, or do you tolerate that as long as the information doesn't leak into the general public?
So obviously this approach we take on misinformation also goes for the groups. We often receive signals about the groups themselves, and then we are acting on them as well. We also have the approach that with misinformation, whether it's someone shares it or someone wants to interact with it, whether on the newsfeed or in the group, what really works quite well is the information label, information that this content is disputed, that this content is something that perhaps was basically fact-checked as disputed. So that's the approach we have. Additional, what was also quite helpful, and the community, especially health community, asked us repeatedly, and we kind of responded, and it's launched since this year, early April, is also the reaction. So basically, let's say you interacted with the false information around COVID, and basically even shared it despite the flag, and then you will have additional pop-up informing you proactively that information you were interacting with is false or disputed, and here are some interesting additional readings you can do. That's the approach we're taking, just because we feel taking everything down, apart from those issues that lead to imminent physical harm, actually somehow amplifies the messages around this misinterpretation of facts, basically. So that would be the approach we take across the apps and also in groups.
Okay, thanks a lot. That's interesting to know. And I suppose we've all seen this on our own social media platforms, especially as the pandemic has evolved. Let me bring DJ in. DJ is a health, sorry, you have a long title in my list. DJ is a public health epidemiologist and microbiologist based in Germany, but also a member of the Young Coalition for Prevention and Vaccination. So I mentioned earlier on about this survey that the coalition has done, and there's a lot of focus, I thought, on how it affects work and education for younger people. In your own line of work, how has your job been transformed in the last 9 months or so?
Yeah,
Yes,
you're not
perfect,
the
yes.
only one. Can you hear me? Okay, perfect. So you're not the only one who's confused by my long title. For one, now everyone knows what an epidemiologist is, and now my parents also finally can explain to their friends what it is that I'm doing during my day job. So that's one thing that changed. We got now a lot more attention, we are, which has its benefits and drawbacks, let's call it like that. And my everyday job has been transformed massively, because in the sense that previously when we worked as a team. There is more than 50 notifiable diseases that we surveilled, the infectious diseases in Germany. And in our team, we divided the diseases. Everyone was responsible for few of those group of diseases and dedicated their research and our work to some of those specific pathogens. But nowadays, in 2020, all we've been working on and focusing on was SARS-CoV-2. So that includes the daily analysis of the data, writing reports for the public. So everything that has been published on our website comes from our department around COVID data and numbers. Then we have been writing reports for local health authorities, for the ministry, and also advising them on specific recommendations and policies. We also help our PR department answer press inquiries regarding SARS-CoV-2, but also other diseases. And we participate in research activities and collaborations with universities, also now in 2020, mainly focused on SARS-CoV-2 and COVID-19. But this is basically also the description of our job that we do usually, but more spread out and focused on a variety of infectious diseases. And now in 2020, it has been all focused on SARS-CoV-2, and we now have it much more faster paced, and we're doing massive overtime during the last 10 hours, so we didn't have any decrease in work because every inquiry, every question, everything was urgent and everything was new and we needed to address it.
So as you're producing or analyzing the data and producing information, how do you think the science is translating into policy for politicians?
Well, the translation into policy has been different in different countries, so I can only address and comment what I've experienced here. And that's that we've been involved in advising our ministry and policymakers, and we had mostly positive experience because we could argue and give our recommendations based on the science, and also argue all the limitations and all the uncertainties and unknowns that are present, because that's a quite novel pathogen. So we could address all of those uncertainties, and most of our recommendations have also been adapted and put in place. Not all, of course, because it's not only the infectious disease development that plays into account into policy development, but most have been implemented. And what I would like to also emphasize is that we had really good communication, and that the policymakers had also high flexibility in adapting and updating the recommendations based on the new knowledge that came in throughout the pandemic and throughout the development.
Okay. Isabel, can I bring you back briefly on that question? Because from your perspective as an advisor, what are the challenges you face in developing policies when the evidence is emerging very quickly?
The problem is that, I mean, we are working every day, and things are changing every day. So it's very difficult to pass the message, and also to coordinate among the member states. So we have twice a week minimum meetings with the ECDC where they are presenting the data. It's very difficult to sometimes to explain that not to the politician or the policymakers or even the general population. And this is something that we have seen all over the pandemic. I mean, we cannot, or I cannot understand why people still don't put the mask. But so we are trying to see how we can make this pass to the general population, but also we have seen that there have been politicians not wearing the mask, and these kind of issues are very difficult for the scientists to understand and to transmit. But this is also true that people sometimes say that, but in March you say one thing and now you are saying a different thing. And also to try to explain that, yes, in March we didn't know that, and now we know this. So that science is not established like that in stone, that is changing every day. And this is really difficult to transmit to the general population.
Okay, great, thanks a lot. So one of the other big dilemmas that policymakers are facing, and this also was reflected in the survey, is how to balance public health and economic priorities. Olivier Ethgen of Serfan Innovation, maybe I'll bring you in for this one. So you're an economist, but you also do a lot of work in the health area. How serious is the impact of the pandemic on the economy, and who is worst affected?
Yes, thank you, Gary. So before I reply specifically to that question, I just want to take the opportunity of this webinar to insist on one thing, because this is not apparently clear. I mean, in media or when you listen to people talking, I mean, you cannot make a split between health and economy. To have a good economy, you need good health, and to have a good health, you need a good economy. Because sometimes you have even politicians or even healthcare professionals or even economists that are clearly have the tendency to make a split. Oh, you are clearly favoring health over economy, or you are making things more advantageous for economic aspect of life rather than for health, and people are crying, and that's not the purpose. I mean, clearly we have to make sure that we all understand and we all agree there is no way to move away from that rules. Good health needs good economy. Good economy needs good health. That's I don't think this is debatable, I will say. So now going back to, yes, just taking the opportunity to insist on that important point. So to go back to your specific question, Gary, yes, indeed. I mean, the impact is huge on the economy. It's still a bit early at this stage, basically to clearly make documents or to put the figures on the real impact that this crisis is having on today's economy. So we will see in the future when we will have probably more data, broader views to interpret what we have been observing over the last few months. I have a tendency, and actually, yes, going back to that question, when you have a look at the OECD projections, so admittedly they are rather gloomy, of course, in terms of unemployment, rate of future bankruptcies, and so on. We are not all treated the same. Let's be honest. I think you are much better in a large corporation today as compared to a small business that has to close its doors, like a restaurant, bars, or small shops. As compared to big corporation, whatever the sectors are, can cope more easily, I think, with the crisis and have many people working from home, or at least reorganizing way of working and so on, as compared to small business. This is for me the biggest issue. Small business that have to close the door and that cannot run their business. The other things I would like also to stress is in terms of these inequalities in front of the crisis. In terms of also of health, of course, having a look at the statistics, this is the elderly that are paying the healthy cost at this stage. Fragile people above the age of 65, and so on. That's clear. This is the people where we are losing years of life. Admittedly, there's almost no. Even there is some exceptional statistics that shows that very young people are also severely affected. So in terms of health, yes, the elderly. But let's also keep in mind that the young generation is nearly sacrificed, if I could say. The term might be a little bit strong, but education and access to work and, of course, anxiety that it is causing to this generation. According to me, I would say that it's mostly the secondary education level and the early years of university higher education, maybe. That is probably the most affected generation. And when having a look, again, a dynamic look at that, it's also a generation that is paying the cost of the COVID-19 crisis today, but it's also the generations that will have to pay the cost of the climate change over the next decades. So this generation is, according to, for me, we have to do something for them, clearly. So There is, again, I don't think this is not debatable. And yeah, that we might take as of today on this crisis, very briefly.
I think I read someone saying recently that the young generation have it easy, except for the global financial crisis when they were in university and the pandemic when they're beginning their career. So yeah, it's been a bit of a difficult time for a younger generation. But there's enormous amounts of money being spent on expanding hospital capacity, and there will be lots of money spent on vaccines, on testing, and so on. So is it possible to calculate the value of innovation that changes the course of the pandemic, that helps us out of this? Like, how do they evaluate a rapid test or something like that for a health economist?
Well,
Priceless, no? It's
so value, as we used to say, value is in the eyes of the beholder. So, of course, as of today, there is a huge need, a huge public health need to have effective vaccine, effective testing, effective, policy in place to tackle on that public health crisis, public health issue. And yeah, I think the value, yes, is huge, but it could be so huge that any innovation, effective innovation, might be considered as a kind of a public good, so accessible to all at no cost. So just imagine, let's make a scenario. We have a highly effective vaccines. This is something that has to be made available immediately to all at no cost. It's a huge value, so you will expect huge value, high price, but not necessarily. So the relation between value and willingness to pay is kind of a bell-shaped curve, So very low value, you are not willing to pay. Very high value, you are not also clearly willing to pay because you want the innovation kind of accessible immediately to all. So you see what I mean by this bell shape between value, perceived value, and willingness to pay to get access to that value. So yeah, so a lot of things to discuss, a lot of theory beyond that, but I would tend to think that this is a bell shape linking value perceived by the stakeholders, different stakeholders, and the willingness they are for the price they are willing to pay to have access to that value.
And is it different for therapies that are used for only a small number of extreme?
Absolutely, yeah. Absolutely, yeah.
Whereas testing and vaccines are for everyone, or else they don't have much value.
Where the perceived value, you might be, and on the value scale, you might be in between, in the middle of the scale. So the price is much higher.
Okay. It's
this bell shape. And maybe one thing also that I would like to insist on this, because we are quite often hearing that we need to extend hospital capacity, but again, let's have some kind of a reality check. I mean, there is no point in economics to invest in overcapacity. It's like a bit when you arrive in Brussels or London or whatever the city in Europe that is completely jammed with cars in the early morning. It's like, okay, to address that, you may say, okay, but we need extra lines on the road. Of course, you may have at Brussels, I think it's 4 lanes. You may have a 5th one, 6th, 7th. Of course, this will, for these peak hours of the day, this will probably address your issue. But for the rest of the day, you will have empty lines for the rest of the day, and you will have to pay for that empty lines. So there is no point. I would say that when the crisis will be over, to have many hospitals beds empty, being empty, that we're gonna have to pay for. That's also, and again, I'm also a bit amazed by, and that's a bit of paradox of our society. I'm a bit amazed how we completely neglect the prevention. As a solution, we immediately think in terms of therapy. So we have a crisis. We need more hospital. We need more beds. And nobody is actually found. Nobody is. Maybe it's a bit exaggerated, but our society, our healthcare system, the way we think we're gonna address public health challenges is by a therapeutic approach, whereas we should basically organize our system, our healthcare system, much more around prophylactic strategies, and that's also something that needs to be now taken into account, at least at the policy level in the future, bringing much more prevention in the way we envision our healthcare systems, and not only relying almost exclusively on therapeutic strategies, by extending hospital capacity, by having more doctors, more nurses, and so on. Yeah, let's go back to the basic, if I could say, in prevention, in public health, meaning prevention, having prophylactic measures.
Okay, interesting. DJ, on on prevention, of course, it should really include behavioral changes, healthy lifestyle, and good diet, which probably would improve your outcomes with COVID and lots of other things. But on vaccine preventable diseases, you mentioned earlier that you used to focus on, I don't know how many notifiable diseases, but now it's all coronavirus. So what do you think is the impact on I suppose on routine immunization, or how we follow other diseases during the pandemic?
Yeah, and if I just may add on Olivier's comment about public, that's the main reason why public health was not so prominent and not so visible to the general public, and why it's not a sexy degree to do if you're a medical doctor, because it focuses on prevention. And if it focuses on prevention, the biggest success is if you don't see sick people. So that's why it was never really seen among the public as a really important part of health, because if public health is doing a good job, then you assume you don't need it, but that's not true. It just means that it works really well. And regarding the routine immunization programs, unfortunately, I can't give you an exact answer to this question. What was the immediate impact on routine immunization programs? Because in Germany, we don't have an immunization registry. So we're not able to analyze this data on vaccine uptake in real time. Usually what we do is we get the immunization status through surveys or studies, or through the regular school entry examinations. So those happen usually approximately half a year prior to school enrollment, and they're analyzed and published every year, so we have consistent data on it on a yearly basis. And due to the pandemic, the school entry examinations that would have happened in April or May were postponed, and were happening now, I think, in September, October. And so I'm not sure on the exact dates, because they differ from federal, state, and local health authorities. So the data are still coming in for this year, 2020. And it's necessary, but here I also need to emphasize that these school entry examinations cover children that are going to start school, so children that are now 5 or 6 years old. So we won't be able to show and see this possible disruption until the analysis in 4 or 5 years. Because if we look at measles or diphtheria or tetanus shots that are usually part of the regular immunization program with children that are around 1 year or 2 years old, or just being born, we won't see that until 4 or 5 years later, until they start school and until they got caught up in this school entry examinations. So, but what was happening is that the Robert Koch Institute, that's the German National Health Authority, published already in April, at the beginning of very early in the pandemic, recommendations to not postpone routine immunization programs, as it has not been seen to pose a risk for developing further diseases, because it's important to keep us healthy and to not get COVID on top of measles or something like that. So it's important to continue the regular immunization programs. But there's a COVID snapshot monitoring study that's been done in Germany every 2 weeks. There's been a questionnaire sent out to randomly to a set of people that they can fill out, so every 2 weeks, and it measures and examines the opinions and attitudes of the German population on the current situation. So the questions also differ in every questionnaire. It's not always the same thing. And this study suggested that there could be a decline in uptake of routine immunization during the pandemic. But again, I need to emphasize this is a measure of opinion and attitudes of people during the pandemic, so we won't know the exact impact it had until other studies and surveys have been done with really measures of seroprevalence and the uptake of vaccines. So we will have to wait for that.
It sounds like you're going to still be busy in a few years' time, even if COVID is under control. Isabel, on the points that both DJ and Olivier were making there about prevention, do you think this whole experience of the pandemic will change how policymakers view preventative health, including vaccines, but also screening and investing in healthy eating and exercise? Do you think this could change things?
No, I hope that there will be a change, but I'm not so sure because, as DG has just said, the first thing that was done when we were in spring in the middle of the mess was to close the vaccination services or to close primary healthcare services. That was, I mean, understandable in a way because everybody was overwhelmed and the professionals were needed in the hospitals and etc. But at the same time was contrary to common sense, I will say like that. And I'm quite worried that what we are going to see in the next year is that are going to happen, to appear, because the preventive measures have not taken place now, and not only about vaccination, but also the cancer screening. During many months, nobody was doing cervical screening or breast screening or colorectal or anything because everybody was busy with other things and the priorities were others. Now, again, in several countries, all so-called non-essential intervention has been postponed. So again, we are convinced that we will see that the morbidity that will appear in some years. So I think that this is important, and that I mean the value of vaccines even is confronted by many people. We have talked before of Facebook, Twitter, wherever there are groups that are against vaccine, not only about the classical vaccines or the vaccine that we had before, but also about the COVID. In a recent study that the IHME presented this week, they see that I mean even 20% and more than 20% in some countries of the European Union. They are not going. They say that they are not going to be vaccinated against COVID if they were offered. This is so. I think that we need to do an extra effort to convince the health professional, because they are delivering the message to the population, as we see in the coalition, but also the general population on the importance of preventive measures. I think that a lot has been done, but that we need to continue on that.
Okay, great. I'm just looking at some of the questions that are coming in, and several of them, Anya, I can tell you are about Facebook or towards Facebook. But in general, you know, Facebook and other networks are in the spotlight this week with the US election and having to fact check politicians, but also for vaccines and for so many other scientific issues. What do you think will be the legacy for social media networks of this pandemic?
Yeah, I do think that everyone has the role to play. And as I said in the beginning of my intervention, the role of Facebook, how we see our role here, is to basically surface as much as possible the facts that come from health organizations across the world, and that goes both for COVID-related information, but also referring back to vaccination discussion we had before, let's say, COVID kind of took over the main pages of newspapers. And I think, you know, this is really important to reflect that being able to surface it is, of course, just one let's say tool that we as Facebook take full responsibility for, but there is a role that everyone, of course, will have to play, is playing: media industry, education organizations, of course, medical profession as a whole, and we as Facebook are here to help and support, and wherever needed. We, of course, not only do our role in terms of COVID info center and other kind of tab that is Get the Facts, where we kind of bring all the information that come from medical professionals across the world into one kind of place if you want to, let's say, check in on the latest. But we also try to support financially organizations that work towards COVID-related efforts, relief efforts, matching the donations, trying to find partner organizations, and further supporting them, let's say, behind the scene, because indeed this whole situation will require us all working together, obviously. And of course, election is a hot, a lot of information about the pandemic or misinformation around the pandemic was surfacing during the elections period, which is why we for a while already deployed our policy towards political advertising, the way we approach those issues around, during elections period. That was here in the European Parliament, but right now in the US, and the possibility to address some of the what we call issues, advertising issues that then are requiring further permissions.
I'm just seeing a question that says, should Facebook and other platforms collaborate with governments to fight misinformation? What do you think of that, especially given that some governments are amplifying misinformation?
I mean, we are always open to kind of any co-regulatory effort. Of course, there are different circumstances, as you just hinted. Facebook is part of the Code of Practice on Tackling Misinformation here in the European Union. It's a self-voluntary effort under auspices of European Commission, where companies, Facebook is part of it, but other companies as well, are took on the commitments, generally speaking, towards tackling misinformation and being evaluated against certain KPIs. These reports are public, they're available on the Commission website. These are not specific on COVID misinformation, they're just broader kind of discussion. But definitely we're open to that. It really depends, and it really depends on the setup. But generally speaking, the position of Facebook here is very clear. There are certain issues around misinformation, especially related to political advertising, certain ways of politicizing some of the discussions that we're seeing, where we would actually seek some kind of regulatory guidance from the regulators to be absolutely sure that we are doing the right things, because sometimes we are told we're doing the right thing from one regulatory authority, and the other regulatory authority somewhere else says, no, this is terrible, you're doing terribly. Sometimes clarity can be only achieved through regulatory guidance.
Okay, interesting one. So another question I see, DJ, this one is for you, I think. So as a young healthcare professional, how has the pandemic affected you? I think you've answered that one, but how can healthcare professionals come together to make a change?
I think this Think Young initiative is one of the good examples how young people can come together and promote health and promote the values that are important for. So collaborate and address problems that you see also in your immediate environment. Educate your parents, educate your friends, talk to them, address their concerns, address their questions, what they are not sure about, and try to explain to them. Like, transparency and communication would be, like, I think, the key words, how to make a change in your immediate environment. And then on a bigger scale, try to collaborate with other health professionals, like this Think Young initiative, Young Coalition for Vaccination and Prevention. Try to emphasize those values and try to promote the things that we're doing together. I hope this answers.
That's perfect. And I'm seeing lots of questions now, so I'll try and go through a few more in the time we have. Maybe, Isabel, could I ask you, are there things that health professionals can do to maximize the uptake of COVID-19 vaccine? The questioner mentions that flu vaccine uptake is still below the target of 75%. So what can health professionals do? And is there anything the Commission can do to accelerate or catalyze this?
I mean, you know that this is not directly under our responsibility, but we work with the member state. The first thing that we can do is to make vaccination easy. So not to put obstacles to the vaccination. If the obstacle could be the price, or could be the place, or could be the professional, I think that we need to fight that, makes vaccination easy. And then to give a coherent message. If we say, oh, flu vaccine, you know, is not so effective, doesn't work value. These kind of messages are going to kill the trust of the population on the vaccine. So I think that we need to all to work together, and we are collaborating with the member states, and we are checking which one is the situation in each member state regarding the uptake of the flu vaccine. But I have also to tell you that this year has been completely different, and this year the countries are going without vaccines. Check the situation in Belgium, for example, where it's impossible to go to a pharmacy and get the vaccine, and everybody wants to be vaccinated because the message, I think, that this year has passed to the population. The only issue is that we are going to vaccinate all the whole population, not just the ones that were defined previously at the risk group, the elderly, the chronic patient, and etc. But we need to keep our priorities. Thank you.
Thanks, Isabel.
If I may add,
oh, please, yeah.
If I may add to that is why I think that the flu vaccine has also suffered, and not a lot of people have high confidence in the flu vaccine, is also due to the science behind the virus and the science behind the flu vaccine, because flu vaccine changes every year because of the biology of the virus. So people have low confidence in that. And the moment we have better understanding of SARS-CoV-2 and better understanding of how effective the SARS-CoV-2 vaccine is, we can also promote it, I think, in a more unison way, as Isabella mentioned, to promote it better in a unison way that everyone has the same messaging regarding the COVID vaccine that will probably be available very soon.
Do you think it'll be more complex, DJ, if the vaccine is not, let's say if it's 70% effective or something like that? Like flu vaccines, part of the problem is that they don't always work in everyone, whereas measles vaccine more or less works every time. You know, have 2 doses and so on. But
yeah, exactly.
It's a complex communication challenge.
Yes, this is always a communication challenge, and that's why I think the messaging around flu vaccine hasn't been so consistent, because there are every year the vaccine efficacy is different, every year the vaccine composition changes, so that causes a lot of uncertainties and a lot of distrust in the population, I think. So of course, if similar things would be seen for the COVID vaccine, it will pose a communication challenge. But let's see what the science will have to say when the results are out.
Okay, great. We won't have too long to wait, let's hope. There's another one here. There's always lots for Facebook, Anya. I think you're very popular. Everyone's on Facebook, so they probably feel they understand this to some extent. So this one's on browsing history. So when you search on the internet, your history is remembered. We know this. But how can Facebook use this information when it comes to misinformation on vaccination? So I think, are they asking if people are repeatedly searching for vaccine-related information, should their Facebook feed be tweaked to give them correct information? Does this already happen?
Thank you. Yeah, I don't see the question, so I think a few things there to unpack. I think someone is, wondering about off-Facebook activity and some cookies, which obviously it's absolutely up to every user to control. What we do on Facebook environment, oh yeah, now I see it. What we do on Facebook environment is that, yes, indeed, there is a memory of what you interacted in a way on your on your newsfeed, meaning that, let's say, you will have resurfaced information that you have interacted in the past with a content that was fact-checked subsequently and deemed false, and this will actively be brought to your attention. So perhaps that answers the question.
Yeah.
I'm not sure.
No, I think it does. And I'm looking, I think there's another one on cooperation with governments, but I think you've already covered that one. Okay, I see another
I think one thing that perhaps this question kind of brought to my attention, and maybe that's an interesting one for many probably follow-up discussions we might have. There's this whole discussion around misinformation versus disinformation, and we also reflected on that internally at Facebook, but I know a lot of others did as well from different angles. And I think that's important to always keep in mind the intent, what's happening, right? A lot of people want to engage on the topic, whether it's COVID or other pertinent issue that is very important to us personally. And we might all, in fact, be guilty, let's say, of sharing some form of misinformation. We read something, we were really passionate about what we read, we want to share it. Subsequently, we learned that this was fact-checked and it's false, and that can happen, in fact, like literally at any given moment, especially as Isabel was also commenting. Those scientific the scientific research is ongoing, so many things are changing. So basically, the intent there was not the wrong one. Disinformation is where there is some kind of intent to bring coordinated effort into, bringing some kind of information, not correct one, for whatever purpose. It can be financially driven, it can be politically motivated, it can be just many different reasons. And this kind of coordinated behavior is where Facebook really tries to put a laser on, because that's where we see the biggest danger into, for example, efforts to keep the population informed and engage in the discussion about vaccinations, engage about discussion about what can you do to prevent the spread, like wearing masks, etc. Where we see this kind of coordinated effort to mislead, that's where we really get very, very worried.
Okay, interesting one. Olivier, another one for you. So some of the things coming through the survey actually that was done show that there's a lot of economic uncertainty. Excuse me. Fewer permanent jobs and remote working. Were these things already happening? And to what extent does the pandemic accelerate some of these trends?
Yes, I suspect, yes, this is happening. But again, we don't have any, we don't have enough a sufficiently broad view at this stage to really talk about future trends and so on. I will say, but it is true that more and more you hear that things are like changing, notably the way we are working and so on. Absolutely, but I get the feelings that, but because home working is not new per se. It's something that is in place for many years already. But we might be moving from a situation where people were spending 4 days per week at work and 1 day per week at home, to the other way, so spending 1 day or 2 days per week at work and the rest of the week at home.
Yeah.
So that's me.
Today, I think we're all at home. That's what it looks like from here. So, and probably most people are at home too. But time is moving more quickly than we want, but that's life. I think I better close the questions, but give you all just a final opportunity to make a final thought. Let's see, DJ, can I begin with you? Put you on the spot. What's your reflection on this conversation, or what's the message you'd like people to leave with?
I'd like people to leave with the message that the science and the governments are doing their best, and we're communicating the best we know with the information that we currently have. So we're not trying to manipulate someone into doing something that is bad. We're just doing the best what we have with the current information that we have. And to close up with, wear your masks and wash your hands, people. That's the best thing you can do.
Okay, great. Thanks a lot. Isabel, would you have a final thought? I'm sure you don't disagree with wear your mask and wash your hands, but have you any other reflection?
Of course. Wearing your mask, wash your hands, keep your distance. I will add. We know that it's hard, but we need that, and that this need to be a collaborative effort. All the population has to be involved, and all the countries have to be involved, because there are no borders for the virus, and no country could fight the disease without working
Great, thanks
with
a
the
lot.
others.
Anya, a final thought on the pandemic and the infodemic?
Just to recap that Facebook is considering its responsibility to amplify and bring to our audiences messages that you health community, economists, and all together trying to bring to the broader audience, and we are here for you.
Okay, great, thanks a lot. And Olivier, a final thought. How do you summarize all of this? But what's your final message to everyone?
So just once again insisting on the fact that we cannot dissociate economy and health. That's economy needs health, health needs economy. And also final thought on that crisis. I mean, again, I'm insisting on the fact that we should put prevention back in the middle of our health or healthcare or political systems in terms of managing future health problems. So, and prevention has tremendous return on investment. So with relatively small investment, you get huge return in terms of public health. Just imagine asking kids at school washing hands few times a day. So I'm sure that before the crisis, many kids at school did not wash one single time their hands during a day. So I don't have data to confirm, but I'm suspecting that was the case anyway. So yes, insisting on prevention, reinvesting in prevention for sure. Although something else that is also coming to my mind, and this is basically probably in terms of education, because I think that a lot of misunderstanding, misinformation lies mostly in the fact that people are undereducated. Even medical staff are not optimally or undereducated in epidemiology. Epidemiology is a science. You have methods. You have kind of rules. You have kind of things to know before you can interpret data or epidemiologic phenomenon. And even in the medical community, this is not always well understood, I would think. So I don't want to be arrogant here, but I do think that epidemiology needs to be much more, learned and lectured at in medical school or even in other type of school. And let's also not forget the fact that, again, in our systems, we have had the tendency to downplay the role of nursing, and I think they are all doing, I think, a tremendous job, and maybe also time to reward them a little bit more than we used to do before that crisis. Yes.
Okay, great. Thanks for that. Well, yes, we've all become amateur epidemiologists this year. Maybe next year we'll all be amateur economists when we try to figure out how to balance all of these things. But thank you all so much. I'm really sorry we didn't get to all the questions. The questions did begin to flow in near the end, but the conversation can continue on those social networks. Thanks all four of you for joining us. It's been really interesting. As I said, about 9 months ago or 10 months ago, we had an event like this in person, and a lot has changed. Let's hope when we convene again on this topic that things have improved, but time will tell. So thank you very much. And with that, we'll end the webinar, and please do continue the conversation online.
Thank you.
Thank you.
Thanks to you, Gary.
Thank you.
Thank you.
Bye.
Ciao.